Hi, my name is Dr. Jeff Mayo. I am a veterinarian in Seattle, Washington. I have a mobile surgical practice, and I've been spending most of my career doing a lot of procedures using radiosurgery and working with different types of tips on different types of procedures. And this presentation is more to discuss things that you should know about radiosurgery when incorporating it into your practice, what you can do it, what you can do with it, and how you should take care of it.
Soniquence has evolved Smoothwave technology to include bipolar turbo for the coagulation of larger bleeding vessels and bipolar dissection. Soniquence's Smoothwave tissue matching technology ensures a smooth and consistent cut through various types of tissue by adapting RF modes according to the tissue's water content. The unique bipolar turbo mode actually uses a lower frequency continuous wave to achieve an appropriate effect on hemostasis.
It is only at frequencies above 200 kilohertz that the energy that passes through the nervous system will no longer stimulate it. More common RF and ES units available in the United States operates in the 300 kilohertz to 2.8 megahertz range, which results in higher temperatures and collateral trauma at the surgery site. The Soniquence unit is based on 4 megahertz range, which is the ideal frequency of operation for your surgery, generating the least amount of collateral trauma to the patient. So let's distinguish the difference between the words electrocautery and electrosurgery. Electrocautery applies to the smaller handheld units that are battery powered. Their frequency is at 60 hertz, and it just generates a lot of heat by passing current through a wire with a high impedance. That heat is transferred to the tissue and creates the effect. These are not devices to cut with. Electrosurgery, on the other hand, is electrically powered, so they typically have a frequency over 200 kilohertz. They will cause volatilization of the water in the cells and use less heat, and they can be used to cut tissue. So on the left, we have a picture of one of these handheld units. On the right, we're holding the power button in, and you can see how the wire just turns red. And it's that heat that's generated that you can use to try to coagulate some bleeding. It's not as effective as having a much higher frequency like a radio frequency unit. Radio wave energy is created by a high frequency alternating current. The resistance of the tissue to the passage of the current creates the heat. The difference in size between the small surgical electrode and larger indifference plate increases current density at the smaller electrode. The electrode itself remains cold, but high frequency energy delivered to the tissues results in volatilization of the cells. So this diagram shows us that as the electrode size increases, the power setting required increases for the same effect. And as you get further away from the electrode, the heat and current density decreases because it is spread out over what we like to call a dispersion pad. These are the more common tips available for use in veterinary medicine and surgery, although only approved for single use. Some people will use these things 10 to 15 times before they need to dispose of them. Larger tips require higher power settings to accomplish a given effect on tissue. I like to use the needle electrode for making small incisions, especially those requiring precision. Particularly if we're trying to remove a small tumor, like around the face, around the nose, where you don't have a lot of skin to work with. We want to minimize collateral trauma so we can maximize our healing. These are nice for planing tissue, and you can change direction of the incision and void a property of the tissue called sectility using a needle electrode. This is used in the cut mode, and you can use a low power setting somewhere between 10 to 15. A loop electrode is used for debulking and removing small tumors. You might use a higher setting somewhere between 10 to 15. A loop electrode is used in the cut mode, and you can use a low power setting somewhere between 10 to 15. A loop electrode is used for debulking and removing small tumors. It is best used in a blended mode, and you might use a higher setting for debulking tissues that may be a bit avascular. The ball electrode is used for coagulation or hemostasis. You can shrink small tumors with it. You can ablate tumors and do something called cytoreduction, hemo mode for coagulating blood vessels. You might want to use a little bit higher setting than you would in a cutting mode, particularly if you're using the needle electrode to create your incisions. So when would I use one tip versus another? The blade electrode is best for incisions in skins and tumors. Due to its size, it doesn't change direction that well. It requires higher power settings. You can turn the blade sideways and use it for spot coagulation. Power settings will be different if using the edge versus the flat side of it. It can be used in a cut or blended mode. Lateral heat can be a clinical problem with any electrosurgical device if it's not set up and used properly. So let's go into detail on the four factors that produce lateral heat during surgery and how you can control those. Lateral heat with carbon dioxide laser use was probably the most common complication in terms of tissue damage. Since lasers cut slower without tactile sensation and require lateral pressure to enhance their cutting effect, it's easy to create what is called a heat sinking effect that can profoundly increase lateral heat and collateral trauma, resulting in delayed healing. Whether you're using a laser or radiosurgery, it's always best to pre-plan your surgical incisions, trying to minimize your contact time with the tissue. So sometimes I'll actually draw my incision lines using a surgical marker before I begin a procedure. Too high of a setting result in sparking at the electrode tissue interface. Too low of a setting will cause the electrode to drag through the tissue and burn tissue edges. An ideal power setting will result in the tissue cutting with ease, no pressure, no sparking, and the ability to move through the tissue at a constant speed. The same machine in different settings. What I mean by that, uh, different things going on in your clinic, different power consumptions coming out of the same circuits, different patients, all will have an effect on how that power setting works. One power setting might work on one patient and it might not work on the next one. You might have to adjust your settings a little bit. So the electrode size depends on the tissue you're going to be incising as well as your preference as one performing the procedure. Size is proportional to the power required, so larger electrodes will take more power, they might produce more scar tissue, and you may see more lateral heat. There's no one correct setting due to a number of problems. One, we have changes in power consumption, usually off of the same circuit. Fat versus muscle content, so the resistance of the target tissue, size and age of the patient, cleanliness of your tip, age of the handpiece, all will have an effect on that. We typically start with a needle electrode on a cat. We might be somewhere in the 15 to 20 watt range, and in dogs, we might be a little bit higher than that. And again, this is specific for the Soniquence unit. Radio frequency works by simply bringing the water in the cell to a low temperature boiling point where it converts in the cell to a vapor. So if you remember, a cell consists of about 70% water. The steam that comes out will also assist in coagulation of tissue and blood vessels in the immediate area, in essence, creating an envelope, if you will. Smoothwave is unique to the Soniquence unit in that the impedance of the tissue being cut is being matched by a smooth, continuous wave from the unit to minimize distortion and dragging through the tissues. So, in the ideal situation, the maximum temperature in the tissue should not go over the boiling point of water. So, as the temperature approaches about 60 degrees Celsius, you'll see cell death, but it might take a few minutes. As it approaches 90 degrees Celsius, you'll get instant cell death, desiccation, protein coagulation, and the cells will start to shrink. So we get up to 100 degrees Celsius, the water in the cell will boil, resulting in a steam envelope in the immediate area of the tissue that you are cutting. Temperatures upwards of 100 to 200 degrees Celsius will result in caramelization of tissue, which will lead to extensive collateral trauma, often seen with lasers. Most rare frequency units should have these basic plugs on the front of them. To the left, we have the monopolar plug, which is for your handpiece. It's going to do your cutting. Your bipolar forcep or scissors, or there's a instrument from Soniquence called the Sonoseal that will do bipolar sealing of some tissue and blood vessels that will go in that port. And to the right, where it says neutral, that's where your dispersion plate goes. Top, you see where it says mode select. Now switch between cut and blend, and then use the buttons to the right for adjusting your power setting. Below that, we see Hemo, Bipolar, and Bipolar Turbo. Again, Bipolar Turbo is unique to the Soniquence unit, and you can adjust the power settings using the buttons to the right of that. The two spots marked fault and neutral simply tells you that the current has been isolated by your device and it's ready to work. So the different waveforms, there's a fully filtered wave that's 90% cutting, 10% coagulation. This is going to give you the cleanest tissue margins to improve healing and histopathology quality. This is ideal for skin incisions and when you're trying to get some aesthetic results. It produces the least amount of collateral trauma and cellular destruction. The coag wave is a 50-50 blended wave, which is ideal for dissection and planing of tissue and is used in highly vascular areas. Hemowave is a 90% partially rectified wave and is ideal for monopolar coagulation and ablation of tissue. We often will use this wave as well for indirect coagulation, which means we put a clamp on a bleeder and then touch the clamp. So, what is hemostasis when we talk about it in radiosurgery? We have white protein coagulation up to 100 degrees Celsius. Cells start to rupture and we break hydrothermal bonds. We get some dehydration and desiccation of the tissue, and these are the properties we're exploiting to seal a blood vessel. Historically, we were using mutated waves, which led to a lot of carbonization of tissue and delayed healing. And the current theory is to use a cutting mode with a lower power and get a more homogeneous seal of the tissue. Indirect coaptation is recommended, and again, that's holding a vessel with a forceps and touching that instrument to create the seal. Methods of hemostasis include direct coaptation, where you're touching the blood vessel directly, indirect, using the instrument. Vascular or coagulation forceps are out there for some machines, and again, Soniquence has a nice instrument called a Sonoseal. There's the ball electrode. Aftermarket instruments don't tend to work well across platforms into other companies' units anymore. And then there are vessel sealing devices out there. Those are very expensive. Bipolar coagulation means that the radio wave only travels between two poles of a forceps. The neutral plate is not required. Silver tips on the ends of instruments minimize tissue adherence and increase performance. Some people say this should define all radiosurgery units as the energy travels between the tip of the handpiece and the dispersion pad, satisfying the definition of bipolar. Sonic unit has a foot pedal. On the left, you can see this is cut and blend. On the right, hemo and bipolar. And you remember from the front of the machine, those are the modes of using the device on tissue. The bipolar Turbo button is in the middle, so whichever mode is lit up on the unit, that's the one that the pedal to the left or right will activate. Bipolar works off of a modulated rectified waveform, and it's a continuous waveform. Both work at 1.7 megahertz frequency, which is significantly higher than traditional bipolar technologies, but we see less burning and sticking of tissue. Bipolar is nice when you might need a little extra added power for coagulation, and you just step on that button and keep an eye on your tissue because sometimes you'll get some very impressive coagulation to the point the tissue might start to pop. I would always recommend bipolar turbo on silver tip forceps. That way you don't get tissue adherence to the instrument. So what is a neutral plate and where should we place that? These plates ground the unit, which prevents the patient from being electrocuted. In essence, the current could leave your handpiece, take the path of least resistance to touch a metal device like a table and go back to the ground. Current is now isolated by these machines, which means it must return to the unit or it won't function. You don't need contact gel or wet towels anymore. You don't have to shave hair where the plate is against the animal's skin. This is an example of a grounded unit. So the plate is not touching a patient, so it's unable to isolate it and register it as returning back to the machine. But the minute I put my hand on a plate, the error message comes to a halt and the unit becomes functional. The dispersion pad on the other side of the circuit there usually is at a much greater surface area compared to the needle tip that you're using. So if you think in terms of like 10 watts coming through 1 millimeter squared, and on the other side it's 1,000 or 10,000 square millimeters, that amount of heat or energy or whatever it is that gets to the other side of the patient is dispersed out over a large surface area, so it's just not possible to burn the patient. Neutral plate has recently been updated to a reusable rubber pad with a longer cable. The connections are more robust, scratch-proof, and the wires cannot be bent at the connections with the plate as in older designs. This plate is not likely to ever burn a patient. Bipolar forceps are available in a number of sizes. They're silver tipped and can be sterilized in an autoclave, but not always the cable, and they can be used to micro dissect tissue. On the left side, we have a anal sac adenocarcinoma exposed using a Lone Star retractor. The thing coming out of the anal sac is a Foley catheter. On the right, you can see the video of us using bipolar forceps to get the bleeders in front of the anal sac and to help complete dissection of the anal sac to remove it. Older technology could not manage to cut well with fat. Soniquence's tissue matching technology can do that quite well. The question is where other tissues can or cannot be cut by radio frequency units. I would not cut an eyeball, I would not cut a tooth, and I would not cut a bone with it. If you need to resect gingival hyperplasia around teeth, it's best to cover the tooth itself just with something like KOI jelly, and that should be fine. These are bipolar scissors being used to take what appears to be a large lipoma out of the hip of a Rhodesian Ridgeback. Once we removed it and cut it open, we realized we had a dermoid cyst. Although there is some bleeding at the surgical site, there's a lot less than there probably could have been had we used conventional technology like a scalpel blade. These are a new instrument from Soniquence. This is called a sonoseal, and this is basically something that appears to be a Satinsky clamp that has been turned into a bipolar forcep. We've used this in a number of things, varying pedicles and spades. We've done neuters with it. Our initial intent was to go after soft palate surgery with something like this, and it works quite well as long as the palate's not too thick. If you have a typical Frenchie who might have 1 to 1.5 centimeter thick soft palate, something like this isn't going to work, and you'll want to convert to the newer procedure called the folded flat palatoplasty. There's a lot of times when you're maybe running radiosurgery in your operatory, and you'll notice that when you press a button or step on a pedal, that you'll start interfering with devices within the immediate area of the patient. This is a phenomenon called antenna coupling. So this is just the ability of the radio frequency to interfere with other devices, to include pacemakers in people, IV Dopplers, and EKGs. This is just stray radio frequency energy that devices are not shielded adequately to protect themselves from receiving that. It typically happens when you get your cords too close to each other, your power cords, and you're using a higher power. So one cord will pick up the other's frequency and you'll get this noise. If you separate the cords and avoid them from being parallel, that will help decrease that. If you separate the plugs to different frequencies, if you can. There's also a device called a radio frequency choke that may help. This ends our first presentation on radio frequency technology. There'll be part one and part two presentations available shortly that will cover things like basic lump surgery, skin flaps, and oral surgery performed with a radio frequency unit. Thank you.